This is a technique called laser resurfacing of the skin to remove wrinkles. This is a coherent ultra-pulse laser, CO2 laser, that vaporizes the skin, and you can see that it is actually taking away the top layers of skin so that it tightens wrinkles. It is replacing dermabrasion and chemical peels as one of our most popular methods of skin resurfacing or wrinkle removal. It's also used for acne scars, sometimes we resurface an entire face, and then it's usually performed under intravenous sedation. For her, we're just doing the crow's feet and lower eyelid area, so we've already injected the local anesthetic. It's important when we're doing localized areas to feather the laser area. Okay. Now we're removing the crust from the first pass with the laser. Okay. Now you're gonna put. I'm gonna go on the cheek area. Okay. So.
You ready now?
So you're going up a little bit?
Yes, sir.
Okay.
A little bigger pattern.
Great. This is a procedure that usually takes an hour or so for the entire face, an hour to an hour and a half, but it takes at least a few weeks where it looks a little raw, and then it has pinkness in the area for a few months that the patient has to hide with some makeup. But it's well worth it to them, for these ladies and men, to rid them of their wrinkles without leaving any changes in color in the pigment of the skin, such as the more traditional peels have done in the past. Okay? Now we're going to remove the crust, and so now we've taken 2 passes here. Okay, now I'm just going to do a little bit more on the eyelid.
Doing okay, Julie?
You doing all right? It's not too scary, is it? When using the laser, it's important to cover the patient's eyes as well as all the personnel in the room are also wearing protective eyewear. Sometimes we put dressings on this, or sometimes we're treated by the open technique. The recovery time really depends on how deep the wrinkles were in the first place and how deep we needed to go in order to treat them. The advantage to this treatment is that once it heals, it does not leave any permanent pigment changes of the skin, such as a deep peel does. Okay, let's go a little bit closer to her lash. What?
You want her in this room, right?
We're going a little bit closer to your eyelid now, hon, so just hold real still, okay? Trying to get those wrinkles that are real close to the top. So we're being very careful here. In this very fragile eyelid area, where we're not sending the laser so deep, since the skin is very fragile and very thin. Okay, hon, that's looking good. Now, she had